I'm really excited to be here today with you and to share my story with you. As Brian so nicely said, my name is Emily. I've worked in healthcare technology for a really long time. And I've been a part of our sector for a really long time, and I've been very frustrated with our healthcare sector for also a very long time. And so we're going to talk today about how you can use your frustration in the healthcare system to create change, how you balance that daily love and outrage, right? That we feel like the love because medicine is so beautiful and the people that we're helping are so amazing and it's a miracle we save all these lives, and then outrage because why is it like this, right? And I'm so excited especially to be here with you because I do feel that care coordination is a place where you guys have a tremendous amount of power to create influence and culture change and to be talking with patients and physicians and administrators and to be kind of that central point. And as I mentioned to somebody earlier, I also love that your title actually is humanly understandable, right? Like you're coordinating care. That's great. Like that's pretty simple. You don't have like a million acronyms in your work. Like what you're doing makes sense. So let's talk about where we are in healthcare today. So if you Google healthcare today, this is what comes up in the Google image results. And I don't know about you, but to me, this doesn't look like the healthcare world that I work in, right? What's missing maybe from this picture? Anything? Patients, yeah. Humans kind of any sort, really. I mean, we have a couple stock photo models holding iPads. This is a very safe, it's a very sterilized view of healthcare. And this is actually something that I've done some soul searching. This is something I was a part of creating. I'm a healthcare marketer, right? I've been in this sector for a long time. I've created plenty of blue websites that make it seem like healthcare is very safe and like fine and don't worry about it. Everything's perfect, like it's all fine. And I've really come to a revelation myself in the last couple years that this is damaging to us as a healthcare sector to get away from the human complexity and the messiness and the emotion of our sector. The more we hide from what makes healthcare really healthcare and what makes our sector really unique, the more it's hurting people. It's hurting us, it's hurting physicians, it's hurting nurses, it's hurting patients. And so let's talk a little bit more about what we can do to get away from healthcare looking like this, because I don't want to look at that anymore. Our title today, I wanted to shout out to one of my favorite ER physicians, Dr. McNamara, and she talks really powerfully, you can look up her video on YouTube, about coming out as human in healthcare. And how it's become very, not dangerous, but it's not safe, right? To say, I'm a human person, right? Like, I'm not feeling good today. Like, this is hard for me. This work is hard for me. I'm burnt out. Like, I need help. These are all things that in healthcare we just are really, really struggle to say. And, as a sector that's supposed to be about helping people, how did we get to this place? Right, where it's not safe to be a human in this extremely human part of healthcare. So healthcare to me looks much more like this, right? It's about people talking with each other. It's about, that human connection that's very healing. It looks like this, it's blood and it's guts and it's beautiful. Like what an incredible, amazing thing that we have these veins, right, in our body. And, that complexity and the beauty and sort of mystery of that, I feel like we're not talking about that very often in our work. And it's incredibly emotional, right? Like this is an honor walk in a hospital in San Diego. A woman who saved 5 lives after she had a brain injury. Her name is Gwen. And this, to me, is the side of healthcare that I think we should be really living in, right? That you can't save everybody, but you can work together and you can try to make things better for people, right? And you can be a part of a system that is very emotional and is powerful and is a miracle. The fact that you can take an organ out of one person and put it into another person and that saves their life, what? That's crazy. And so this is an emotional topic for me because I was almost that woman doing that honor walk. And so this is a photo, it's a little dark, but This is me 3 years ago as an ICU patient. It's actually a very nice photo, well angled to show not the 9 IVs that I had, right, and the situation I was in. So this is really the turning point in my own healthcare career. I had a very severe postpartum hemorrhage. I had an amniotic fluid embolism, which if you know what that is, that's not good. You have about a 20% chance of survival in that situation. I went in completely healthy. As a healthcare person, of course, I was like, I'm going to be able to navigate this hospital so well. I know all my doctors, I know all my nurses, it's gonna be fine. I've got this, right? I have this deep trust in the healthcare system. It's gonna be amazing. Yeah, let's do this thing. And then I promptly bled to death, right? So 10 minutes after my daughter was born, I entered DIC, which is when your blood can no longer clot. I lost all the blood in my body 9 times over. So I received 32 blood transfusions in 6 hours. And when I woke up in the ICU, all of a sudden everything had changed. I was an ICU patient, right? And that's something that you don't want to be in your life. How many people here have been maybe ICU patients themselves? Yeah. I had all these IVs, I had the central lines, I had everything, and I couldn't turn off the part of me that really enjoyed watching the hospital work, right, at the same time, but I knew how dangerous it was for me as a patient to be in that situation and all the risks that came with it. So I was saved, obviously, spoiler alert, I survived. And thankfully, because of maternal care quality program in California, there was a protocol for cases like mine, and there was excellent coordination between the blood bank and the hospital to send cooler after cooler of blood in a specific order. Everything worked as it was supposed to work. Unfortunately, women in most other states in the country do not have these protocols. We have the worst maternal mortality rate in the country, or in the world of any developed country, as you might know. It's about the same safety to give birth in Haiti as it is to give birth in the United States. And the situation really unveiled to me as well. I was in this very state-of-the-art, brand new hospital, but something was really missing. There wasn't a sense of me as a human. And one of the things that hurt me the most was the hospital actually tried to separate my family. So my daughter was a PICU patient, and I was an ICU patient. She was discharged. And they said, well, obviously she has to go home with a nurse. You just need to hire somebody to take care of her, and it will be fine. Just hire a nurse. You can stay here in the hospital. And to me, I was in a women's and children's hospital. The idea that you would want to keep women and children together doesn't seem exceptionally complicated to understand for me, right? And I wasn't that sick. I could, I understand if I had been completely unconscious, yes, of course. But I was very inspired by my husband, who became a care coordinator overnight, having not showered for 3 days, and fought with the hospital and signed all kinds of paperwork and was allowed to keep my daughter in the hospital with me for the rest of my stay, which was a week. And we had to hire our own private nurse to come at night to take care of her so that he could sleep. She had to sign paperwork saying that she would be well behaved and not disrupt the other patients. And so we still credit that she is very well behaved today because she signed that very official legal form in the hospital. But it really just goes to show, the thing that was most important to me, that ability to stay together, was the thing that was absolutely miles away from the hospital administrators and the different departments. And I really am so grateful to the nurses and the people who fought for me in that situation. And I'm very grateful to my entire medical case, A, because I'm fine, amazing, and B, because I think of all the terrible, terrible things that can happen to you, I am really honored that my life was saved by blood donors, right? And it's one of the most human places, I think, the idea, like an organ transplant, the idea that strangers give their blood. We don't like to talk about blood in healthcare in general, but here's this very bloody thing. They give their blood, somebody processes it, they don't know where it goes, and it saves someone's life. And what an incredible system in our healthcare world that we have that And so I spent a year actually tracking down my real blood donors, and we had an event, and I got to meet them, and it was like, oh, you can imagine, it was really emotional. But to me, again, like that honor walk, this is a place where healthcare, I think, really shines. It's so human. It's such a great relationship between people. And it set me, I think my entire understanding of the healthcare system really changed from that moment. So let's go on to the next one. I also became a case manager patient, which was exciting. I don't know if anybody here has ties to Care First in Maryland. No? Oh, damn it. Okay, so one person actually called me when I was in the hospital, and it made a huge difference. And I've become a lifelong evangelist for Care First Maryland because somebody called me, tracked me down, a case manager, and just said, hey, are you okay? Don't worry about the bills. We've got you covered. It was a 3-minute phone call. I have no idea who this person was. I never heard from her again. No other case managers or care coordinators ever showed up for me. But that call really, really stood out. I still tell people all the time, oh, Care First Maryland. Like, if you can ever buy insurance in Maryland, like, you have to go with Care First. Like, their case manager was so amazing. She called me, and think of that very simple phone call. Like, that wasn't something that cost them a huge amount of money, right? And like what a difference it made for me for the rest of my life. And the research has shown that actually when we think about people as being human, it makes us better care providers, it makes us better physicians, it makes us better people. And today we're going to talk also about women's leadership. I think that women uniquely can't drop the concept of being human in our work in the way that maybe other people can, right? We're always going to be parents and caretakers and children and having complex lives, and that's just kind of the way it works. And I think that's actually an advantage for us because we bring those experiences into our work. So this is an example. There's a study where if you show images of the patient to a radiologist, they work like twice as long on their scans, and they are twice as good at catching things. When you show nurses who they're prepping the surgery kits for, again, work twice as long, care twice as much about what they're doing, feel connected and connected to the humanity of their work, and that's very, very powerful for them. And University of Michigan, I think also in the same vein, has started apologizing, right? When they make a mistake, they're very upfront about it. They have on their website, we don't know all the answers. We are humans. We make mistakes. And they've actually had their malpractice litigation drop 40%. So the thing is as patient, to put on my patient hat, we know that healthcare is full of human people. You guys are just hiding from us, right? And if you just came out and said, hey, we're human people, guess what? We understand how that works. It's pretty exciting. And so in my own medical case, I know that there were medical errors that were part of my case, right? I know that there were factors that led up to what happened to me. But I also was very fortunate. I knew the physician who was treating me at the time, and I knew the hospital, and I had a human relationship with that hospital, right? And so I was able to say, I'm sure mistakes were made, but we got through it together, right? And it creates a different kind of relationship, one that I think is very healing for people in healthcare. Before we move off of this, there's one more stat that I really love, and it's that researchers worked very, very hard to see what would actually help with recovering from colds, right? The common cold. Everyone right now is talking about the coronavirus. It's a very hot topic. But the only thing that they found that actually helped people recover from colds a day faster was when they felt that their physician had cared for them, when they had a compassionate relationship with their doctor. It beat Zicam, it beat vitamin C, zinc, everything that you could possibly treat the cold. The one thing that reduced the duration of symptoms was having a physician who appeared to care for you. There is tremendous power in somebody just saying, I care about you, I want to help you, I'm here, I'm listening, I'm understanding what's most important to you. And I think, especially as care coordinators, you guys are right there. I'm preaching to the choir, and it's so exciting for me, because the work that you're doing is right in that sweet spot. In the book that I wrote, and that many of you already have, and I hope more of you will get, called Procedure, which was part of my recovery, a year after I did the event to meet my blood donors, and then 2 years after I wrote a book about how can we change the culture of medicine. And there's a quote in the book that I love from Asha Collins, who is the head of clinical trials at Genentech and who is also just like a force of nature, an incredible person, wrote that, people are valuable, people are the value in healthcare, right? It's so easy to forget about that in our work, right? That the people are the thing, and not just the people that we're treating and caring for, but also the people that we're working with. It's all about the people. And treating people respectfully is so important. There's the book. It's gorgeous. So I'm going to wrap up my storytelling part of a talk with a couple recommendations, because I think it's very easy for us to say, yes, let's make healthcare more human, right? We all want that. Let's do that. But how do we actually lead and create that kind of change? And I would love to have you guys tell me and ask me questions, and let's open up this conversation about what's working for you guys as leaders, especially as women leaders in healthcare. But I have a few rules that I think that we could try to follow. First is less jargon. Acronyms, there are so many acronyms, and I think like those blue logos in the stock photos, the acronyms and the jargon is a way of protecting us from the truth of our work. And that protection is damaging, it's harmful to us, right? And so yes, of course, you have to talk about CCRs and there's a million acronyms and I love them all. But imagine if we talked about healthcare in a way that people could actually understand what we do, and that you weren't shutting out people from understanding the influence of what you guys are trying to do. I work in healthcare communications and marketing. Like I said, I know this is super, super hard. But this is something that I try to really hold myself to in all of my work. There are ways to explain what we're doing that anybody can understand and that allow us to have human conversations about our work that aren't just acronym soup. So that's the first one I think that we can all work on. Maybe one less acronym tomorrow. 2, no stock photos. It's very easy to buy that same picture of that same doctor, right, for your flyer, your presentation. There are so many photos now that you can take that you can get from the internet. Everybody has a camera on their phone. We can do this. We can take real photos that really look like healthcare and that reflect what we are really seeing and really trying to do. By choosing those same photos of the white coat, and they're all taken in Belarus or something, they look so strange. That's not reflecting the truth and honesty of our work. So no stock photos. And then the third rule is the hardest one, but is to take care with people. And that obviously starts by taking care of yourself, which is really, really hard. But if you are able to say, I am a human person and I have feelings and the things that I'm feeling are correct and the concerns that I have are valid, you can take care of yourself, you can help take care of other people, right? And so when we talk about burnout in medicine and we talk about the lack of leadership and the sense that we don't have agency to control anything or to change anything in our healthcare system, it is not true. You can all do something to create change, and if we can take care of ourselves first, I think that that's so powerful. And so taking care with people also is just recognizing that, people have flaws. Everybody, right? Patients that you're taking care of, certainly people that you're working with, and physicians, we all have really bad days sometimes. But if we can really respect each other as humans, I think that's incredibly powerful. And I say this as somebody who is very responsible, and I take that burden of having been a part of some, trying to kind of dehumanize healthcare in the past. And so now, you're part of my sort of coming out tour, right, or recovery tour, if you want to say, of trying to say, how can we work together on this to make our healthcare system a little bit better for everybody? And so I think with that, I would love to open it up for Q&A and just have a conversation with you guys. I see a lot of people nodding along, which I love, and I hope that this is helping to kind of put the cap on the end of your week. So let's do that, and I'm going to just go to that slide. So how much time do we have left? 19 minutes, perfect. Okay, so who has a question or a statement? Yeah, something that you want to talk about. I'm going to come over to you. This is good. I'm going to get my exercise before I get on the plane back to California.
It's the most valuable last 2 minutes. You have no idea what have you said.
Oh.
You have no idea.
I'm so glad, thank you.
Your very first statement of this respect, trust me, it's one medicine which can heal 80% of what's wrong in healthcare.
Yeah,
One simple thing.
yeah. So you're gonna do it.
Trust me, what I'm going to do is what you said, the last one, take care of yourself,
Yeah,
which I have not done.
yes.
But going forward, I will.
He's gonna take care of himself. I love it. Oh, thank you. That's so great.
So I wasn't going to do this, but since the mic is here, thank you for this beautiful, very emotional talk. But in the name of respect, what's wrong with pictures taken in Belarus? And I get the sense, I sort of get the message, but...
Sure. So no discredit to Belarus and all. It's just that all the stock photos are taken in Eastern Europe. Yeah. So it's just more about let's have some photos that look like different places. Yeah. Belarus is terrific. No offense. Who else has a question or a story or something that you want to share? Who has created some kind of change that you feel like is part of this?
I think it's still morning, yes. Good morning, all. I'm Belinda Brown-Tazarian. I'm the Associate Director for Patient Care Services at the Detroit VA, and I'm the nurse executive there. One major change that we've done over the past 3.5 years is implemented a model called relationship-based care and transition that into shared governance. And in that model, I know most of us know what that is, but I think for us, it's made a huge difference in helping people to go back and recalibrate why they do what they do, why they began the work that they've begun, and building respect for whatever each member of the team brings, and building ways of partnering and communicating on a basic human level, and holding each other accountable for that versus the very, vague ways of being and doing. And that's made a big difference in terms of autonomy at the front line and people just coming together to say, this is the way our patient's experience is going to be, who comes, and that includes not just the nurses, but the doctors, the pharmacists, the social workers, the EMS team members, any team member who is in any way engaged. And then, of course, we added the DAISY Award, which actually gives acknowledgement and representation for really getting to what matters for families. So that's been very helpful for us.
I love that example because it's talking about incentives. We all know our incentives in healthcare are very broken, but how can you create some incentives that carve out a little space to reward the human part, right? Or the improvement or the things that make a little bit of a change. I'm going to go behind you. One of my least favorite types of jargon is also when we talked about patient-centered care. Because what is not patient-centered care? How do you have care that's not around a patient?
Thanks for sharing your story. I think the one thing that and we sort of need these reminders, I think, as we get into this. But one thing that we've done at Emory, which I have found that I have learned so much from in terms of facilitating meetings and initiatives, is we do have a patient family advisor program. So anytime we have any sort of strategic meeting or plan that's rolled out, we have representation. And these are patients who have been through our system. They've either had a great experience or they've had the absolute worst experience. And so they are our most significant critics. And there's been things that I've been all proud of, and I get in front of the patient family advisors and I'm like, all right, I'll be back later, guys. It does require to hear the voice of the patient even when you think you're hearing it and you're developing something great, it really just helps to have that voice.
Thank you so much for sharing that. And that's a great reminder that we are going to get things wrong and it's okay. I have gotten a lot of things wrong in my life. Certainly Belarus, sorry. we all make mistakes, right? And so, but that's fine. We're people. We're just trying to do our best job and trying to help each other. Does anyone else over here want to? No? Who else wants to say something? We just have a few more minutes before we wrap up. How many of you have been, I know we talked about being an ICU patient, but how many of you have been just in a hospital, admitted to hospital, right? Was that a very transformative experience for you, to see as the other side as a patient? You get barcoded. You get stripped of all your clothes. You can't do anything. You know, for somebody like me with my personality, like I do really well if I have a job. And so I gave myself a job in the hospital. Like I was in charge of ordering food on the TV for my whole family. And I figured out the algorithm that if you like didn't order salad dressing, you could get an extra fruit plate and like all this stuff. And I felt like so empowered by having that job. Like these are basic human needs that we have. And so how can you give somebody not just, you know, maybe their clothes back, but also, right, like how can you give them something to do as a patient and not just have them like your job is to be there and lay there and be adherent to the things that we're trying to say. Who else? Anyone? Last statement? Yeah. I'm going to squeeze behind you. Thanks.
Hi. So I'm an infectious disease physician, and talking about jobs and my inpatient patients, I found that it's better, especially with people who are there for either pneumonia or diabetic and foot infections. I give them a job, and so we have something to talk about besides laying here and talk about nausea. And most of the jobs I tell them to do, I'm like, okay, well, you have diabetes and you haven't been controlling it, and that's why you're here with an infection. So I want you to think about some things you can take away when you go home and some things that you can improve on. And you're going to talk to a whole lot of people, nutrition, nursing, everything, but I want you to come up with a game plan. So that, like saying jobs is very important because it gets the mind spinning and less focused on, well, I was woken up at 4 a.m. to be stuck or, or someone else came in again, so I think it is very helpful.
And also jobs, not just for yourself, but jobs for helping others is an interesting area that I don't think we tap into in healthcare enough. Like back when my grandmother had my mom, you would stay in the hospital for like 8 or 9 days after, right? And it was more of just like leisurely. You weren't really a patient. But she would have a job. She folded diapers and she like contributed. And by the end of my stay, because I had been in the hospital for so long, like I knew all the routines. Like I knew everything. I knew how to fold the chucks in like the right way. And I would have loved to have had some kind of job, which, I get hospitals, they work in a certain way, but like, can you tap into that and like the base human desire of trying to help somebody else, right? So maybe coming up with your diabetes plan, like could you help somebody else do something? It's often much easier to teach than to try to create your own change, right? And that's a very human piece of it. Anyone else? You've been nodding a lot. I feel like you might have something to say. No? You just like it. There's one in the back. Oh, good. Okay, we'll do this. Maybe will be our last one. This has been really fun to be with you guys here today. I really appreciate it.
Hi, thank you so much for sharing. I just wanted to reinforce the acronyms that we use. There's a whole body of literature about health literacy and how we, we try to teach patients, but if we're using acronyms, I think most of our literature is geared towards the patient and has been vetted, but we forget what comes out of our mouths when we're talking. And even if we walk in a room, if we're a care manager and we say, do you want to go to a SNF or a rehab? And patients are totally do not know what we're talking about, and they don't know, one, what a SNF is, or what possibly rehab is, or they're thinking it's the same thing. So I just wanted to reinforce that. I think hospitals have their own culture and their own language, and it's a barrier to patients.
I think that is so super well said. And not just a normal patient who's not part of the healthcare system, but also somebody who's having like probably the worst day or the worst week of their life, and you're throwing a bunch of jargon at them. My father at 90 entered hospice and passed away this summer, and even though I know so much about healthcare, at least I thought I did, like it was horrible trying to navigate what the social workers were offering to us and the choices between what home hospice or this and that. It was completely daunting and terrifying, and you have often like 15 minutes to make these life-changing decisions, right? And so if somebody could just speak to us honestly, those are things that are so powerful. I think we're about at time, almost. A couple more minutes. So I just wanted to say thank you again all for your time, and to also just really do one more campaign pitch here, that you have more power to create change than you might be thinking. right? I mean, I think there's a lot of us who feel like, again, that love and outrage, that balance of like, why is the healthcare system like this, and how can I be a part of it as a force for good? But it's so big and so daunting and so much bigger than all of us. But I have seen, in the years since I did the book and I've been speaking about this topic, I've seen so many people who've been able to create change. Small little thing that turns into a bigger thing, that turns into a bigger thing, right? And like, you really, really do have the ability to create positive change in healthcare and to create a system that is the kind of system that you'll want to use yourself, because guess what? We are all going to use the system ourselves, and if we don't fix it now, when we ourselves are in hospice or we're in the ICU, like, it's going to be there still waiting for us. And life is short. We need to get to work. And I'm just so grateful, again, for the work that you guys are doing as care coordinators, and also for your time and attention here today with me. And I just hope everybody has a safe journey back home. So thank you so much.